Hello, Madison. I'm Jessie. I'm going to do a health assessment on you. Is that okay with you?
Yes.
Okay. I've provided privacy by shutting the door here. Are you warm enough? The temperature's warm enough? Okay. I'm going to start off. I'm just going to wash my hands here. And I'm going to start off with your height, weight, and vitals. If I could have you just stand up on the scale. At 160. And just turn around for me. Scoot all the way back from there. Okay. 60 inches. Just go ahead and have a seat back right there. Your toe. $98.2. Get your blood pressure. $118/64. I'm just going to check your pulse here. Okay, your heart rate's 62, respirations were 17. Now I'm just going to start, can you tell me your full name?
Madison Aaron Cotton.
And your birthday?
9/5/95.
And do you know why you're here?
Get a checkup.
And you know where you're at?
Chambers Memorial Hospital.
Okay, so you're alert and oriented to person, place, time, and situation. I'm just going to start off by inspecting your skin. Look for any lesions, masses, any bruising, scars, temperature, warm. I'm going to check your skin turgor here. Goes right back down, looks good. Your nails, contours good, no clubbing. Capillary feels good. Check it on your feet here. That's good. Okay, now I'm just gonna inspect your scalp, look for any lesions, masses, your hair distributions, evenly distributed. I'm just gonna palpate it here for any tenderness. You tell me if you feel anything tender. Any pain, anything?
No.
Okay, your head's normal cephalic. It's good shape for your body. I'm going to palpate your temporal pulses here. That's good. Now I'm going to palpate your temporomandibular joint. I'm going to have you open your mouth and close it one more time. No crepitus, smooth movement. I'm going to palpate here in your frontal sinuses. Any pain?
No.
What about here in your maxillary?
No.
No? Okay, now I'm going to have you read this chart over here. I'm going to have you stand up. You can just cover one eye with your hand and then just read the lowest line that you can.
D-E-F-P-O-T-E-Z.
Okay, other eye.
DEFPOTEZ.
Okay, you're 20/20. You can go ahead and have a seat. Okay, I'm gonna just inspect your eyes. They're even, symmetric. Your hair distribution on your brows is good. And then I'm gonna look here in your conjunctiva. It's pink and moist. Sclera is white. You've got contacts in. Just look straight ahead. Cornea looks good. Okay, now I'm going to do visual fields by confrontation. I'm just gonna place my hand behind your face. As I bring it forward, you tell me when you can see my fingers moving.
No. 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 No.
Okay. And now I'm going to have you cover your eye. I'm going to check the muscles of your eyes. Just cover one eye. Look straight at my nose. Uncover your. Good. Other eye. Uncover. Good job. Now I'm going to have you follow my finger with just your eyes, okay? Don't move your head. Do this one more time. Okay. Now I'm going to check your corneal light reflexes. I'm just going to shine a light right here. Just look straight up, straight ahead. Make sure the light hits the same in both eyes, and it does. Now I'm going to check your pupils and make sure they're reactive. Good. I'm going to check it again, but I'm going to watch the opposite eye to make sure it's consensual light reflex here. That's good. And now I'm going to have you just kind of turn sideways a minute. I'm going to place my finger about 3 inches in front of your face. I'm going to have you look at my finger and then look at a spot on the wall. Back at my finger. One more time at the wall. I'm just making sure your pupils dilate when you look far off and constrict when you look close up, and that's good. Okay, now I'm going to, your pupils are equal, round, and reactive to light and accommodation. And I'm going to inspect your ears here. I'm just going to have you move your hair back. Make sure they're symmetric. Look for any lesions or masses. I don't see any. I'm just going to palpate them. Any tenderness?
No.
How about when I move the tragus here? Any tenderness there?
No.
Okay. I'm going to use the otoscope and I'm going to look inside your ears here. I'm just going to look at the canal, make sure there's no redness or drainage. Tympanic membrane is pink and pearly gray. No bulges or retractions. Let's see your other ear. Looks good. Now I'm going to do check your hearing. I'm going to do a whisper test. I'm going to have you plug one ear. I'm just going to whisper something and you repeat what I said.
Red.
Okay, other ear.
Black.
Good job. Okay, now I'm going to inspect your nose. Make sure it's symmetric and midline, and it is. Look for any lesions or masses. I'm going to palpate it. Any tenderness?
No.
Okay. I'm going to have you plug one nostril. Breathe in. And the other. Paint and see if the nostrils is good. Okay, now I'm going to inspect your mouth. I'm going to put on some gloves here. Make sure your lips are pink and moist, not dry and cracked. I'm just going to pull your lip down here. Look for any lesions or masses. Nothing there. Can you open your mouth for me? I'm going to look for any diseased teeth. Open wide. Diseased teeth or lesions or masses in here. Can you stick out your tongue for me and lift it up? Okay, it's nice and shiny. Okay, go ahead and put your tongue down. Say ah. Uvula rises to midline. Tonsils are a +1. Palate looks good. Looks good. Now I'm going to do, let me rewash my hands. And I'm going to, here I would verbalize, we would check your gag reflex, but I'm not going to check your gag reflex today, okay? And I'm going to inspect your neck, make sure it's symmetric. And check your trachea. I'm just going to palpate here and looks good. I'll do your carotid pulses while I'm here. Okay, I'm going to have you touch your chin to your chest. I'm just going to check range of motion and lift it, lean it back, side to side. Can you try to touch your ear to your shoulder? Other side. Okay, now I'm going to check the strength. Try to push against my hand. Other. Okay, and can you shrug your shoulders? Good job. Okay, now I'm just going to inspect your chest. I'm going to move around to your back, your posterior. Let me get my stethoscope. Oh wait, I'm going to do your lymph nodes here first. Go ahead and put your hair back. I'm just going to palpate them. You tell me if you feel any tenderness, okay? This is your preauricular, posterior auricular, occipital, submental, submandibular, superficial cervical. I'm going to do your deep cervical chain here. No tenderness?
No.
To the other side. This is your posterior cervical. And can you arch your shoulders forward? This is your subclavicular. Okay, that looks good. Now I'm going to go around to your back and listen to you and look at that. I'm going to look for any moles that you might not be able to see, any lesions. I don't see anything. Your skin's warm. I'm going to check for chest expansion. Just have you take a deep breath in. That looks good. Oh, okay, now I'm going to just percuss here, okay? Okay. No tenderness there?
No.
All right, I'm going to listen in the same spots, okay? I'm going to have you breathe with your mouth open just a little bit deeper than you normally do. If you get dizzy at any time, just tell me to stop, okay?
Okay.
You feel okay?
Yes.
That sounds good there. Can I have you just lay back and I'm going to assess your heart sounds? Okay, your apical pulse is fifth intercostal space midclavicular. Let's start off just by listening to your valves here. This is your aortic, pulmonic, tricuspid, and your mitral. Now I'm just going to do it with the bell of the stethoscope here, same places. Now I'm just going to count your apical pulse for 1 minute, okay? Okay, rate was 64 and it's regular. Now I'm gonna go with your abdomen. I'm just gonna have a look at your belly here. I'm gonna raise your gown up. Just right there is good. I'm just gonna look at for symmetry. Let me get my light here. Look here. Can you take a deep breath in for me? Let me go to the feet here. Okay, again, deep breath. Okay, that looks good. I notice you have some striae here, just and a scar. You know what that scar's from?
Work stenosis.
Okay. Now I'm just gonna listen to your bowel sounds, okay?
Okay.
I'm gonna start in your right lower quadrant. Okay, now I'm just going to listen to your vascular sounds here. Start with your aortic here. Just get your right renal, left renal, your iliac, other iliac, your femoral, okay, that sounds good. Now I'm just going to percuss your abdomen here, just light tapping, okay? Let's see, we'll start here. No pain there?
No.
Okay, I'm just going to lightly palpate your abdomen, okay? You tell me if you feel any tenderness. Anything?
No.
Okay, now I'm just going to push a little deeper, okay? You're all right?
Mm-hmm.
Okay, now I'm going to try to palpate your liver over here. Just going to push up. Maybe take a deep breath in. Let it out. Another deep breath in. I'm going to go up a little higher. Okay, now your spleen. Okay, I get your kidney here. Your other one. Any pain?
No.
Okay, that looks good. Now I'm just gonna verbalize that we would check your femoral pulses and your inguinal nodes there. Okay, I'm gonna have you sit up and we're gonna start with your extremities. I'm just gonna make sure they're symmetric. You're on your shoulders, just to let your arms relax. Okay. No skin lesions, I already checked that out. Okay, I'm gonna have you stand up for me. I'm just gonna have you do what I do, okay? I'm gonna palms and go straight up and back down. Back hard, got it? Mm-hmm. Okay. And now I'm gonna have you up, bring this one down, go all the way across. Other one. Okay. Let me see here. I'm gonna palpate your epitrochlear nodes here. Any tenderness or anything there? Here. This one. Good?
Mm-hmm.
Okay. Now I'm going to assess your, you can go ahead and sit down for me. I'm gonna do your elbows. First I'm gonna feel back here. Just kind of bend your arm a little bit. Any pain there?
No.
there?
No.
Okay, and then can you extend them up and then back down? Nothing there?
Mm-mm.
Okay, I'm gonna check your radial pulse and your brachial. Same on this hand. Okay. Now I'm going to do your wrist and your hands here. Let me feel your joints here. Just tell me if anything hurts. See that? No tenderness there?
No.
Okay, can you hold your hand straight out like this? Can you bend your wrist down, back up, and then now just your fingers. And pointing back up. Okay. Can you, I'm gonna hold here and you try to pull your arm back to strengthen your arms here. Same thing there. Okay. And then, let's see, your wrist. Can you try to pull your wrist up? Your wrist? There you go. Now that one? Okay. I'm gonna grab this table here for a minute. Just gonna have you set both your hands on the table here. And can you, don't move your wrist and just turn your hand out. Back in. Other one. Okay. And then spread them apart. Can you make a fist? Okay. Now, let's see. We don't need this anymore. And then, okay, I'm gonna have you with your hands touch your fingers, and then the base of your pinky. Okay, other one. Good. Okay, now let's do your lower extremities. I'll have you go ahead and lay back for me. I'm gonna start with your hips, just legs flat out. And leave one leg flat and raise this one up as high as you can. Okay? Now, same leg, bend it and pull it back. Okay? Now can you rotate it in and then out? Any pain there? Okay, put that leg flat and do the same with this one, straight up and down. To out, in, nothing there. Okay, and your legs are nice and pink, hair's evenly distributed, no varicose veins. Okay, now your feet. Just gonna check your feet here and your ankles. Any pain there?
No.
Sorry, you're ticklish, I know. Can you rotate your ankle out and in? Same thing with the other. Okay, with your toes, can you pull them towards your nose? Now point them towards the feet. Okay. Now I'm going to check your dorsalis pedis pulse and your posterior tibial. Okay, that looks good. All right, and then I'm going to have you sit back up for me. Actually, I'm going to have you stand up. And I'm going to have you walk to that chair so I can assess your gait, see how you walk. Just walk to that chair and then walk back. Okay, come back. That's good. Okay, I'm going to have you turn this way. And then I'm going to have you bend over and touch your toes. I'm sorry, you're down. Any pain there? Okay. Can you lean back? Okay, and then lateral, yeah. And then twist your shoulders around. Other side. Nothing there. And then while you're standing, I'm going to check your legs. Can you stand on one? And then the other. Okay. And now I'm going to have you stand there with your hands at your side. This is the Romberg test. We're going to test for your balance. And just close your eyes and see if you can maintain that position for 20 seconds. I'll stand right here beside you. Feel okay?
Mhm.
Okay, that's good. You can have a seat back on the table here. And now I'm gonna check the sensation. We're gonna do light touch and then sharp and dull. What I'm gonna have you do is just close your eyes for me, and then I'm gonna touch your face, and you say now when you can feel it, okay?
No. 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 No.
Okay, that's good. Okay, now with your arms, hands, legs, and feet, I'm gonna use this tongue blade to dull in and a sharp in, and you just tell me if you feel sharp or dull, okay? And you just leave your eyes closed.
Sharp. Sharp. Dull. Dull.
Just put your hands out for me.
Dull. Dull. Sharp. Sharp.
Okay, same thing on your legs.
Sharp. Sharp.
Try that again.
Dull. Sharp. Dull.
And your feet.
Dull. Sharp. Sharp. Dull. Dull.
Okay. All right, now I'm gonna have you. I'm gonna have you do your finger to nose here. I'm gonna have you alternate like this, with your eyes closed. Okay, go faster. Okay, that's good. Okay, now I'm gonna have you pat your legs. You're gonna do front, back, front, back. Good, good. Okay, and now I'm gonna have you lay back down one more time. Sorry, I know it's a lot of laying down, sitting up. I'm gonna have you bend your knee, touch this heel to this shin, slide it up to your knee and back down to your foot. Okay, same with the other leg. Okay, just relax your legs there. I'm gonna check what they call Babinski reflex. So I'm gonna rub this across your foot. It may tickle, I'm sorry. All right, negative for Babinski there, that's good. All right, now I'm gonna check your reflexes. I'm gonna have you sit up for this. Last time you have to sit up and lay down. Sorry. I'm gonna start with your bicep. So I'm just gonna have you just relax that arm for me. Okay, and we're gonna do your triceps here. Just bend that, just let your arm go dead. Good. Same thing with this arm. Just bend it, let it go dead. Okay. Now let's see this is your brachioradialis. I'm just gonna hold on to your thumb here. Just flex your arm. Same thing with this one. Okay. Now, can you scoot to the edge a little bit? I'm gonna check right there's good. Just let your feet dangle. Check your patellar. That one's good. Okay. And now your Achilles. I'm just gonna hold your. Okay. And that completes our test. Do you have any questions?
No.
Nothing at all?
No.
Okay, that completes our health assessment.